To review the latest updates of the novel coronavirus in the Sultanate, we have with us in the studios Dr. Saif bin Salim Al Abri, Director General of Disease Surveillance and Control at the Ministry of Health. Dr. Saif Al Abri, welcome to our studios and thanks for joining us today.
Thank you.
Dr. Saif, we have a few questions for you. Could you kindly brief us on the coronavirus and its symptoms?
Coronavirus is a big family of viruses that causes disease in humans, ranging from as mild as common cold to as severe acute respiratory syndrome like SARS or Middle East respiratory syndrome coronavirus. And also this is the third one, which is the novel 2019 coronavirus that right now, as we know, that it can cause fever, cough, and lower respiratory tract infection, which is lung infections. And in severe cases, it can cause lung failure, severe respiratory illness, kidney failure, and also death.
Okay. Doctor, we want to know, are there any confirmed cases of the coronavirus in the Sultanate so far?
We don't have any confirmed case of coronavirus so far, but we are in full alert at present.
And what are the prevention measures that people could take to reduce the risk of acquiring the virus?
First of all, the virus right now is mainly in China mainland, and so most of the cases now, although the disease has spread to more than 25 countries around the world, but almost all of them have travel history to China. And even when there is local transmission within those countries, it's mainly linked to people going to China or coming back from China. At present, in Oman, we don't have cases, although we do have suspicion in some cases, and they are under investigation. But we didn't confirm any single case yet. So most of the thing is that it's mainly preventative. So if there's going to be any case, most likely it's going to be imported from somewhere where the disease is endemic, which is most likely right now is China. Maybe in the coming few days, it might be other countries which may get endemic with the virus. So we do advise people that if they travel to China, when they come back, we would like them to make the self-declaration. Now we have self-declaration at all points of entry in the Sultanate. So we do advise people to fill in the self-declaration, and in case they have been to China in the last 14 days prior to the arrival to the country, to identify themselves to the public health authorities in the ports of entry, especially, for example, the airports. And then the right procedure will be done. But also we do advise people to protect themselves from respiratory viruses. For example, by covering their mouth and nose when coughing by either the elbow or a tissue, and then washing their hands with soap and water, or by using the hand sanitizers. And if someone is sick, and also to avoid mixing with sick people with severe respiratory illnesses. And in case they become sick with severe, for example, cough and fever and difficulty in breathing, then to seek advice to one of the health facilities and avoid going to work or to mixing with other people.
Okay. Doctor, you mentioned you have some suspected cases. So what is the process of dealing with these kind of cases? Like, do you have a special test to detect the virus?
Yes, we do. So in case, for example, someone presents with fever and cough, and we have a case definition of whom should be a suspect case of the new coronavirus, the novel 2019 novel coronavirus, then if they are symptomatic and they need admission to a hospital, so they get admitted to a hospital. The main thing is really to take care of these patients, and although there's no vaccine or treatment right now, but they will receive the right supportive treatment for the whatever infection is there. So whether we prove novel coronavirus or not, we do have now the test available in our central public health lab, So the main thing is really to look after the patient himself, but at the same time to prevent any spread of the infection to other people, whether it's the staff of the hospitals or the healthcare facilities or their close contacts, whether it's in the community or their family members. So it's mainly initiating the infection prevention and control measures in all health institutions. And also, in case there's a suspect case in any of the ports of entry to the country, we have a full process, a framework of how to respond to such cases, where the best thing is to look after the sick patients, but at the same time do our best to minimize the spread of the infection to the community as well.
All right, thank you so much, Dr. Saif, for joining us today.